Is it or is it not the start of an endemic phase of COVID-19? Now, this is the question with regard to Omicron, and while answers may differ, the consensus is that a fresh path needs to be charted amid the global fatigue over pandemic-related restrictions. For more, I have Professor David Kwak from Sooncheng University. Welcome back, Professor Kwak.
Good afternoon.
I also have Dr. Kim Seung-taek at the Institute Pasteur Korea live on the line. Hello, Dr. Kim.
Good afternoon.
And joining this session virtually is Professor Monica Gandhi at the University of California, San Francisco. Professor Gandhi, it's a pleasure to speak with you again.
Thank you.
Professor Kwak, Korea's daily tally has been posting record highs, and for the first time in about a fortnight, the country's critical cases has risen to above 300. What is your assessment of our current COVID-19 situation?
Well, I think we're closely following what other countries have gone through when they went through the wave of Omicron in their own countries, such as the US or even Japan, or even Israel for that matter. When we roll back about a week ago, we had a similar conversation assessing why Israel is going up very high and steeply in their caseloads of ICU bed units. I think we're also very likely to see that happen in our country as well. It usually follows about 2 weeks after the peak of the wave itself that the ICU bed capacity starts to be filled up. So in about a week or so, or maybe starting this week, we are very likely to see the number of patients who become very severely ill to fill up in the ICU bed units and whatnot. And hopefully we'll be able to manage within our capacity. But it is also a great time that we need to really prep ourselves for incoming patients who needs to be contained in an ICU units.
Right, and while Korea has yet to see its peak, Professor Gandhi, over in the US, I understand the country has hit its peak. Do you agree, Professor Gandhi?
Yes, I mean, essentially about 2 weeks ago, the cases started coming down after hitting their peak. Hospitalizations followed about a week later. Our death rate is also starting to decrease, so everything is going in the right direction, which is leading many states in our country to ease restrictions at this point in the pandemic, hoping that this signals that endemic phase, as you spoke about at the beginning.
Right. And Dr. Kim, when do you suppose will Korea witness, hopefully, a similar scenario?
Well, I think basically I have to say the prediction is really difficult. Even when just some expert in some prediction, I mean the institute or department said that even just predicting just 2 weeks later is very difficult because there are many variables, including the human behavior and also a very different immune status, whether it is due to by the vaccination and then by natural infection. Earlier in the pandemic, the prediction is really just relatively easier because no one was actually immune to this virus. But now just the immune status is very different. And even for the vaccination, the people got several different kind of just the vaccine. So that actually efficacy and the protection level is quite just different. So basically, I have to say this prediction is very just difficult. But then what I can say is that as Dr. Kwak said, we will actually follow the very similar just the trend of just the infection, that was actually shown in the U.S. and other just European countries. And then those countries actually experience very sharp peak of just infection and very explosive infection and then transmission. But however, in the case of Korea, we might just experience a little bit just a different scenario because paradoxically, we actually have a very good quarantine system. So if I just assume maybe just theoretically a similar number of just infections, you might have just some broader just a distribution of just the infection cases, which means that we might just a little bit just delayed just the peak and then will be just a longer lasting just a peak in our country.
Right. And staying with that, Professor Kwak, what are your thoughts with regard to Omicron's projected peak here on the local front?
Well, just about a couple of weeks ago, when we had a short conversation with the head of International Health Matrix and Evaluation in the U.S., he made the correct prediction for the peak to happen in the U.S. at the right time. He made the prediction that in Korea, we would face our peak on either February 14th or 16th or so, which is about now to the next couple of days. I believe when I noticed that there was actually a plateau being drawn on the graph over the latter part of the half of the last week or so. And I believe that might be due to what Dr. Kim Seung-taek has just mentioned, that our immune status within the population is quite different from either in the US or for any other countries for that matter. But also at the same time, because we have gone through the Lunar New Year holiday weekend, there were much greater chance for us to mingle up then and be exposed to the infection. I think that might have brought the peak or the timing of the peak a little forward, and we might have gone through the peak hopefully in the past couple of days or so, peaking at around 56,000 to 58,000. So I'm hoping that we have gone through the peak already, and I'm hoping that it'll, from today and on, we'll see the drastic drop in the numbers as we have gone up in the same fashion. But there is also possibility, as Dr. Kim already mentioned, that we may see a slight delay in the progression towards the peak as well as dropping from it due to the differences in the immunity rate. So we would have to wait and see.
Right. Professor Gandhi, as you mentioned, in line with the decline in daily caseloads over in the US, a number of states there are moving to drop restrictions, including mask mandates. Now, what are your thoughts on the timing of this decision?
You know, you mentioned at the beginning of the program pandemic fatigue. And what that really means is that it has been a long 2 years. And I think that what people and most experts are coming to the conclusion is we cannot eradicate COVID-19. It is not our fault. It's not humans' fault. It has to do with aspects of the virus, the fact that it has animal reservoirs, that it has a long infectious period, that it looks like symptoms of other respiratory infections. And finally, our immunity, though very good against severe disease, as we've seen in enduring variants and different variants, where they're less likely, the vaccine's less likely to provide sterilizing immunity, which means that we can transmit. All of that put together means it's very difficult to eradicate the virus. And at some point, we decide when we feel the virus is under control with vaccines, highly effective down to the age of 5, therapeutics, which are monoclonal antibodies, Paxlovid and Molnupiravir, 2 oral antivirals, and let the public go back to a relatively normal state. And I think that's what you're seeing reflected in the dropping of mask mandates in the United States across multiple states. It has nothing to do with partisanship. It's both Republican and Democratic states that are dropping their mask mandates for indoor spaces for the public. Doesn't mean that many people won't mask. Doesn't mean that we shouldn't pay attention to ventilation. But I think it's also reflecting a reality 2 years in.
Right. And staying with that, Professor Gandhi, the move to lift mask mandates comes in spite of the CDC's recommendation for face masks within indoor settings. Does this lack of consistency, so to speak, look to affect the country's containment campaign?
Well, it is very awkward what's going on in the United States right now. You're absolutely right, because we have a Democrat-controlled presidency, and the CDC is not approving lifting of face masks. And the states, which are mostly Democrat, this last Monday, a week ago, dropped their mask mandate. So there's a complete disconnect about what's happening. Now, on the other hand, the CDC has indicated that they may change their guidance to not look at caseloads, but actually look at severe disease and vaccination rates, hospitalization and vaccination rates, as their metrics for lifting mask mandates. If they do that, we can become in alignment in the states and the federal government. Right now, we're not in alignment. The State of the Union address here from President Biden is on March 1st, and we're all wondering what's happening with this incongruity.
Right. Here in the country, Dr. Kim, local health officials themselves have also hinted at the possibility of an ease in COVID-19 restrictions despite surging caseloads in the country. How do you explain this shift in stance, Dr. Kim?
Well, I think the first of there are a couple of reasons, I think, but the first one is probably just the Omicron variant. The Omicron variant, although this virus is very contagious, but it seems to just cause very mild disease, just compared to some previous variants. So that's probably number one reason. And then the second reason is probably just the vaccination rate. And in Korea, well, the Korean people now, we have attained more than 85% of just complete just the vaccination. I mean, in this case, a 2-shot, just the vaccination. So this is just pretty high. So then maybe we might be just a little bit just confident on the some preventing the severe just cases. And then we are also just probably just monitoring some examples of other just foreign countries, including some European countries and potentially some U.S. And but now just today, the government authorities just announced that now we are seeing just a little bit just the increase of severe cases of COVID-19, and then just considering the this time, I think this a little bit just increase maybe just reflect the surging of the Omicron variant. Just the Omicron now, well, we know that it causes a less severe disease. But if the number of just the infections so high, then the chances are we are seeing more just a severe COVID-19 patient. So I think just before deciding whether we just ease the current social restriction guidelines, maybe we'll just government will just very cautiously just monitor the current status and then decide whether to just pursue just some easing or like just maintaining just the current social distancing just the guidelines.
Right. And while we wait for the government to make its decision, Professor Kwok, what are your recommendations with regard to a future framework of prevention guidelines?
I think we have to stratify the implementation of the restriction within our population, because by now we all know that the infection itself really affects people differently according to their immune status as well as especially their ages. I strongly agree with the general direction of what's government's taking and its path, that they are trying their best to protect more vulnerable people now that they want to give PCR tests to only those people who are above 60 years of age. They're strongly encouraging for those people to get booster shots and whatnot. So in that direction, in that regard, I think maybe, and I'm saying this partly because there are also accumulating evidences that the natural immunity caused by infection tends to cause much longer lasting immunity as well as stronger immunity once if it's given after the vaccination. So I think we need to think hard to come up with a way to protect those who are very vulnerable, such as those who are elderly, but not only limited to them, because it's also known that for even younger generations who tend to be obese, people with, let's say, diabetes, severe underlying conditions also tend to be vulnerable. So we need to protect them. But at the same time, if we could give somehow in a very safest manner, the younger generation who are less vulnerable, who are likely to go through the infection if they are boosted with a shot, very mildly or possibly without any symptoms, to possibly go around, be exposed to and obtaining natural immunity, I think that'll actually create better chances for the country as a whole to gain some of a fighting level of immunity against any future variants or even SARS-CoV-2 when there has to be another wave to come into the country. So what I'm basically trying to say is stratification in its implementation of social distancing should be taken, and special attendance or care should be taken towards those people definitely more vulnerable to the disease, especially for those elderly and for those, let's say, either obese in their BMI level. But also, and I always make this comment at the end of the whole conversation, but let's not forget, there are also children who may be vulnerable to disease, yet still not allowed in our country to receive any vaccines, because vaccinations for people between ages of 5 to 11 have not been allowed to receive any vaccines in the country. They need to be allowed. I'm not saying they should be mandated to receive that, but for those who choose to receive vaccinations, still should be given the choice to receive them. So I think we should not forget about those people who still want to go ahead and get the vaccines. We should encourage everyone to receive them, but also at the same time focus mainly on protecting those who are vulnerable to disease as well.
Right, and staying with vaccination, Dr. Kim, authorities on this Monday also announced their plans for a second booster dose for those in the high-risk category. What are your thoughts on the efficacy of this latest prevention measure here?
Well, I think those the recommendation guideline was also just actually just made in the U.S. CDC just last month, and then that's only for the people with some immunocompromised condition, and I think those that people actually do not just elicit very just strong or just a very enough just immune just a reaction compared to some general public, some healthy people. So it might be just helpful for those the group of people, but for the some general public. This second the booster shot is not really just considered yet, and then there's no just enough just scientific evidence which actually supports the second shot of just the vaccination. And I think as of now, once we just finish the well actually first shot, now we regard this as just the primary just the shot series. Then with this shot, our just protection is pretty good. I mean, especially not just for the antibody response, but for the some cellular immunity, which is actually just made by the T cell response, is pretty just good and robust and then very long lasting.
Right. Professor Gandhi, Dr. Kim mentioned the CDC and talking about that entity, it claimed COVID-19 booster protection wanes after 4 months. Could you tell us a bit more about this finding?
Yes, I think it's important to stress what Dr. Kim just said, that when we say immunity waning, we should keep in mind that it's one aspect of immunity waning. You're right that the booster shot, after about 4 months in the CDC, published on Friday, does the booster shot, the antibodies from the booster shot go down. Same finding in the UK after about 10 weeks. But that's only one arm of the immune system. Antibodies go down. But your T cells, which Dr. Kim just mentioned, protect you against severe disease, and they seem to be long-lasting. And B cells are the recipe book to make more antibodies if needed in the future, aided by T cells, and they will make more antibodies if needed in the future. So the protection against severe disease in that large CDC study was maintained. So it's severe disease versus more mild infection. Antibodies will protect you against more mild infection, but you have to, if you keep on boosting, you'll get those antibodies, but we're unlikely to boost except for vulnerable people. People continuously just to keep our antibodies up. That isn't usually a strategy in infectious disease. So likely only the immunocompromised or very older patients with multiple comorbidities will get a fourth boost. And that is the right thing to do, going to what we're talking about here, trying to protect the vulnerable in a population, but allowing younger people, especially who are vaccinated, to have more of normal life.
Right. Professor Kwok, Novavax is now being offered to adults here in the country. And beyond them, what can you tell us about its safety for expecting mothers?
Well, so I dug a little bit into the general basics of how Novavax came about. So the biggest advantage of Novavax is that its method has also been applied in other original types of vaccines that we used to receive before. So this method was actually implemented in influenza vaccine, for example. But unfortunately, there has not been a great amount of evidence that accumulated in COVID-19 Novavax vaccines in pregnant mothers. But it is, I think, scientifically deducible that because it worked very safely with all other clinical trials and its participants, I think it'll be safe to use in pregnant mothers. Just yet, there is no clear scientific evidence that proves it. So, but in the near future, because the method has already been used widely in other types of vaccines, I think we'll be able to see COVID-19 Novavax vaccine being used in pregnant mothers or even in children for that matter without any concerns for the safety.
Right, and in children, we're talking about those aged between 5 and 11 then?
Yes.
Right. Dr. Kim, what are your thoughts on the recent government action here in the country to address disruptions in the distribution of COVID-19 self-test kits?
Well, I think just recently we actually experienced some shortage of the self-test kits in just a local pharmacy or some convenience stores. And then I think this situation actually reminds me of the sort of the shortage of the basket, but in the early of just the COVID-19 pandemic. And in the end, we actually just just increased up our capacity to just the manufacturing to those masks. But I think compared to such a mask, the cases, I think for the self-test kits, we are in a some better situation. And then somehow just the companies, the diagnostic just kit developing company, they were actually just well advanced just in terms of just preparation of just these the self-test kits. And well, just fortunately now just the government authorities actually approved just a couple more just self-test kits from domestic just the companies. So and this will somehow just alleviate the some current situation. And then in the end we will have just enough just amount of self-test kits in especially in Korea.
Right, and speaking of rapid antigen test kits, Professor Gandhi, what can you share with us about the Biden administration's rather ambitious plan, that is, to distribute these self-test kits to Americans free of charge? I understand the government is buying 1 billion test kits.
Yes, so each household was supposed to be able to get 4 test kits. And I have to say, we've already peaked and a lot of these test kits just simply didn't arrive in time to help us through the Omicron surge. The same with N95 masks that were distributed by the government. It just went so fast. It went up and then it came down fast, like we were speaking about before. And many of these test kits haven't come. So it was a great plan to send them out to people, 4 test kits per person, but it wasn't working out as well as they'd hoped.
Right. Meanwhile, back here in the country, Professor Kwok, members of the public are being granted greater autonomy with regard to testing, tracing, and even treatment efforts. What are your words of advice given this reality here?
Well, the springtime is coming. The weather-wise, but also COVID-19 pandemic-wise, I hope. So I think it'll be a great chance for us to actually take, as a primary care physician, that is, take everything outside, do some exercise, start enjoying the weather, especially for those who are healthy, but also for those people who might be more vulnerable to disease. Let's still keep the common senses and keep washing our hands, keep wearing the mask as it is socially guidelines right now. But I think it'll be a great chance for once this wave is over, I think the springtime will come and it'll be for us to enjoy that moment.
Right, and hopefully you are right. All right, Professor Kwok, as always, thank you very much for your thoughts. Dr. Kim, thank you for being with us today. And Professor Gandhi over in the US, thank you very much for your insights.
Thank you.